Today, a potential temporary setback in the fight against COVID as fears of a fourth wave become reality in some places. At least 41 states are asking providers to temporarily stop administering the Johnson & Johnson one-shot vaccine, following a recommendation by the FDA and CDC this morning, quote, out of an abundance of caution. Experts will now examine potential safety issues after 6 women under the age of 50 developed an extremely rare blood clot within weeks of receiving that vaccine. One of them died and another was hospitalized. The vaccine was approved for emergency use by the FDA in February and has since been used to effectively protect nearly 7 million U.S. adults from COVID. The Biden administration says this will not have a significant impact on their vaccination efforts and stress the importance to skeptical Americans that the other available vaccines are still safe. Watch.
The bottom line is the vaccines, Moderna and Pfizer, that are now being administered are clearly safe and are saving lives, and every American should get vaccinated when it's their turn.
There have been no red flags. When you have a red flag of something that is as serious as thrombotic thrombocytopenia, particularly when you have an individual, one of whom died, you take that seriously.
Joining our conversation, MSNBC medical contributor Dr. Kavita Patel, a former health policy director in the Obama White House. Donna and Jason are still here. Dr. Patel, I spoke to a senior White House official who said that they were prepared for some challenge in this rush to vaccinate Americans and to beat these variants. And that is why they purchased so much supply of all of them, frankly, but especially of Pfizer and Moderna. How do you evaluate this news today on J&J?
Yeah, I think it's really, hopefully I can just give people some solace in what you said. It's rare, extremely rare, and I can talk about all the other types of adverse effects, side effects, and things that we see in other vaccines. I'm not dismissing the person that died, the families that are dealing with it. They are incredibly affected by it. But you can't vaccinate billions of people and have zero side effects, adverse events, or risk. I think the key here is that the FDA, while many are criticizing it and saying that they were overly aggressive, the FDA is doing what the FDA is supposed to do, look for safety signals. I think the decision to pause has been confusing, and I hope that by tomorrow afternoon, when the CDC Advisory Committee is scheduled to discuss and vote on what this means, we will get clarity. But as you heard, I think this was the right thing to do. And I would ask the question, what's the alternative? How many of these cases of clots on the heels of what we're seeing with AstraZeneca across the world would we wait for? And it would, either way, Nicole, it feeds into vaccine kind of myths and misinformation. So I think our job today and going forward is to fight it and to reinforce to people these are safe, these are effective, and we still have people dying from COVID, and these vaccines prevent death.
Well, that was my next question, and you got there ahead of me. It seems that to people listening to Dr. Fauci and yourself, we're going to hear that in context, right? But to the disinformation echo chamber that is doing a lot of harm with communities that are reluctant or hesitant, do you fear this fuels that anxiety among those populations?
Oh, absolutely. This is, I describe this and I feel this. It's been a long time since I felt really depressed. And today, listening, watching the press conferences, I was depressed because it's a gut blow to the world's vaccination effort. These are really good vaccines. I would say that about AstraZeneca, too, that the risks are far less. The benefits outweigh the risks. And I'm watching countries, entire countries, family members who have died in India and Pakistan, and they would give anything to have a chance at one of these shots. And Nicole, I was just on the phone with our clinics. We are looking at possibly throwing out doses if people don't want this vaccine. And at the same time, I've got 20-year-olds in the hospital. So I think that this is a gut blow. And I think it reinforces something we've talked about, that we have had so much misinformation, such a lack of credibility in the science. Anybody who is concerned or curious, we'll be watching tomorrow as the CDC is covering this, and we want to bring those conversations transparently to light. And that's the most important thing we can do. If anything we've learned through January 6th and everything that's happened this past year, we need more of these conversations to be public and to look at the facts. And that's exactly what we're going to do. And that means the fact is, if you're not vaccinated, you are that much more likely to be susceptible to getting COVID, and you have a much higher risk of having all of these bad events.
Well, and with long COVID out there, I mean, Donna, it is such a, I don't know anymore if we're wired for nuanced medical information. I mean, I worry that some of those receptors were bludgeoned over the last 4 years, and especially the final year of the Trump administration. But a setback is really where the difference between the last guy and the current president is most clear. And to contemplate what they might have done to medical information is really a scary thing. Can you just pick up on Dr. Patel's comments about and offer your insights about how the Biden administration handled this news today?
Well, first of all, I thought the level of transparency was really revealing to me and reassuring. And I have a family member who just got the J&J vaccine in that cohort on Sunday. And so we were all, as a family, as lay people, really listening. And it was helpful to hear the medical information, that information can get out to doctors so that they will know how to recognize and treat the conditions. Information about what patients should look for. I thought Dr. Fauci did an amazing job explaining that in the press conference today. And so what I can contrast that with is the level of transparency that's been offered by the Biden administration, so that as lay consumers, as medical professionals, we understand what's going on right now and that we're preparing ourselves for it. And so I was actually, unlike Dr. Patel, I was actually really comforted by what I heard today, because it gave our family some level of, quiet after the initial storm.
Jason, I have not a lot, but a couple of not anti-vaxxers, but just vaccine frightened people in my life. And I know that this news it sort of lands differently. If you're vaccinated and you've sort of been relieved of some of the anxiety of the last 12 months, you become almost evangelical in your, in your enthusiasm for everyone to get vaccinated, not just so you don't get sick, but so you don't transmit the virus to anyone you come in contact with. If you're in that category that's not we'll talk about them another day, but that's just simply frightened, this news was hard today.
Yeah, Nicole, and I have a lot of people in that category in my life, the people who are like, I don't know if I want to go, I don't know which one I want to take, and there's a lot of sort of anecdotal things out there. What will be interesting is to see public trust for Pfizer versus Moderna versus J&J, because that's where it really comes into play. I've had conversations with people who their fear is that they can't choose, because they somehow have it in their head that one vaccine is significantly better than another. And I've tried to explain to people, look, it's like if you go to McDonald's or Zaxby's, there's Coke products. If you go to Carl's Jr.'s, it's Pepsi. It doesn't matter. It's still Coke, right? It's still soda. Just get whatever vaccine is available at the place you can go. But I think what we're facing now is, look, we already know that the white conservative Republican men are the least likely to take the vaccine even when it's available. But the bigger issue is that sort of squishy middle, which are people who think that there's some radical difference from one vaccine to another, and that may make them delay in getting something that's readily available. And that's I think, the real public policy concern going forward, making people realize that there's not a radical difference between one or the other.
Dr. Patel, I'm going to let you speak to that. I wasn't given a choice, and I don't really know a lot of people that were, but can you speak to the efficacy of all three of the vaccines in America?
Yeah, all three prevent death, which is, incredibly amazing when you think about just the fact that I can say that, given all the death we are still seeing with COVID. And all three prevent severe hospitalization or dramatically reduce the risk of ending up in an ICU or being severely hospitalized. And now we're getting data across the three vaccines that there is probably an incredibly low risk of giving the virus to someone else. And then because we're talking about variants in Michigan and New York and Florida, all three so far are effective against the variants that we're recognizing in different degrees, but effective enough to overcome them today. So this is, this is a time when all four of us can agree, but the messages are going to be mixed. I'm very worried just because I have a lot of young women of color who have been hesitant because of all these concerns about what these vaccines could do to their pregnancies, fertility. And just explaining this is going to be hard. I suspect we might see some advisories to clinicians to avoid the Johnson & Johnson vaccine in a certain age group in women. That will also help. But Nicole, we're going into a phase now where our country likely will have choices. We have vaccinated enough people, and we're going to have supply. Pfizer's CEO just announced that they're going to be able to push ahead by 2 weeks more vaccine. So I beg the question, the United States is going to be in a luxurious position to have a choice. The rest of the world is not in that position, and we can't do a vaccine. We can't end this pandemic without taking a global responsibility, and that's where I'm a little worried.
Well, and that's something that we should spend more time on here, because if we just can remember what happened a year ago, I mean, if the whole world isn't safe, then none of us is safe. This happened because we live in a world where people are free to come and go. Dr. Kavita Patel, Jason Johnson, thank you both so much for being part of this really important conversation. I'm grateful.